When something goes wrong during medical treatment, it can be devastating. For the victims of mistakes made by or in the healthcare system, they can complain to the Office of the Health and Community Services Complaints Commissioner. But in the 7 years since the office opened, critics say not one investigation report has been made public. And now there are questions as to whether the office is fulfilling its obligations.
According to national studies, the cost of medical errors in Australia is over $1 billion annually. In South Australia, victims of medical errors can take their complaints to the Health and Community Services Complaints Commissioner, which, in the 7 years since the office first opened, has been Lena Sedano.
They came out with a review as well too, and a review of the Act. Yep.
Anne Gratchinen is one person who's contacted the Commissioner with a complaint. She believes her husband Tom was the victim of a series of medical errors.
There were a number of incredible things which just absolutely rocked us. We just didn't know what on earth was going on.
Tom Gratchinen began being treated for heart problems. When he died in a public hospital, Anne Gratchinen was told the cause was heart failure. But later, she says she was told other things contributed to his death.
At the end of it, the person in charge of the ICU told us that Tom had died of heart failure, that the heart was now completely wrecked and that's why he had died. But in subsequent meetings several years later, it's been conceded that, in fact, my husband had died of kidney failure.
Anne Gratchinen contacted the Health Complaints Commissioner but was told the case wouldn't be investigated because it had been more than 2 years since her husband's death. Mrs Gratchinen believes the 2-year time frame should have been measured from when she became aware of a potential medical mistake rather than from the date her husband died.
I was devastated and I was in total despair because I'd really pinned all my hopes on being able to take a complaint to her.
Anne Gratchinen isn't the only one who had a complaint. An independent report released in February last year found that the South Australian Commissioner has the lowest number of resolutions per number of complaints in Australia, at just 1%. Amongst the 21 findings in the report, an average of 3 complaints were managed per day. More than $1,500 was spent per complaint, only Queensland was more expensive. There's no office people can visit. The first point of contact is a phone message bank, and the office has an ineffective organisational structure. The Commissioner declined to be interviewed, but during a parliamentary committee hearing, she admitted that information in the office's annual report was incomplete.
With respect... This is another report published by the agency. The taxpayer have a right to accurate information.
No, I absolutely reject that. I've made it very clear on the public record that these documents are incomplete and inaccurate. I don't think I've used the word inaccurate, but I've certainly said they're incomplete and should not be relied on to give you the whole picture.
Ms Sedano has told the parliamentary committee that a lot of the problems in her office are due to underfunding and a bad IT system. She's defended the fact that in the 7 years she's been Commissioner, she hasn't made a single report from a completed investigation public.
If you read further through Part 6, you'll see that I may release those reports, but I don't have to. There's not a must there. I do have to ensure that the report is done and is available on the record, and that is done.
Stephanie Miller is the Executive Director of the Health Consumers Alliance. She says resources have been a problem for the Commissioner.
Introducing a new IT system is always a very resource-intensive activity, and the Commissioner's Office have wanted to focus on external relationships and building the profile of the office, encouraging people to speak up, and I think they've done a good job of that.
Stephanie Miller says the Commissioner hasn't met everyone's expectations, but she says the Office of the Commissioner is new and has been doing a good job of meeting the challenges an emerging organisation faces.
There have been, a number of successes, specifically the Charter of Health and Community Services Rights. We now have a statutory charter in South Australia, which is a great achievement for us as health consumers and carers.
The Commissioner's 7-year contract comes to an end this week, and she has not sought reappointment. The Health Minister, John Hill, says the office needs changing. Do you think it's appropriate after 7 years of being in that position that they're still having unreliable annual reports and an unreliable IT system?
Well, yes, I do, and that's why I'm going to have a very close look at how we can make this system work better. We had been speaking with the current Commissioner about how we might do that, but the change in personnel allows us to do it in perhaps a more dramatic way.
A new Commissioner has been appointed, Steve Tully, who is currently the Electoral Commissioner in Victoria. Unlike Lena Sedano's 7-year contract, his is only for 12 months. The Health Minister is thinking about moving the Health Complaints Commissioner into the State Ombudsman's office, where they can share resources.
I'd see a distinct Commissioner, who could be a Deputy Ombudsman or some other title as well, who would have the responsibilities for looking after the complaints, because this Commissioner can also look at the private sector as well, and that's something that the Ombudsman can't do, so we need to maintain that sort of level of authority.
Pam Moore from the Health Rights Community Action Group says she has some concerns about the Commissioner being moved into the Ombudsman's office.
We feel, though, that for the public, we really need to have stability in an office, knowing that there's going to be an office there.
For Pam Moore and Anne Gratchinen, the important thing is that the Health Complaints Commissioner remains an independent authority. They just want it to have more impact.
I've never wanted mandatory compensation, but what I really, really would like is for this not to happen to anyone again. And so it needs somebody to take that on board and say, what's gone wrong. Let's find out how we can improve things so that it really isn't repeated for anybody else.
There are mistakes happening, serious mistakes. The only way to stop the mistakes, prevent the suffering that happens to people, is to have a proper complaints authority that deals with the matters independently, which then lead to systems change.
Leah McLennan reports.